Hi, my name is Nidia Vanessa Garcia, and I will be presenting today the changing criterion single subject design for this final assignment. The purpose of this study was to determine the effect of contingently reducing the length of dysphagia therapies on improved, consistent, and independent use of dysphagia behavioral modifications. One adult man was recruited at a hospital to complete the treatment program. During treatments, the participant alternated liquids and solids during oral intake until criterion was reached. If the participant reached the criterion level for the treatment session, no further practice was required. This is what I call the reduced length dysphagia treatment. However, if the participant didn't reach the criterion level, he was instructed in the use of the behavioral modification for 15 additional minutes. Amounts of alternations of liquids and solids were recorded during each session. Results showed that the participant met the criterion for all levels, achieving a 100 criterion completion. My research question is, I am studying an adult with moderate oropharyngeal dysphagia because I want to assess the effect of a reduced duration of dysphagia therapy on the dependent use of dysphagia behavioral modifications. In other words, I want to see if providing a reduced duration dysphagia treatment can be used as a reinforcement to increase participants' responses during treatment sessions. My claim is the consistent, independent use of the behavioral modification of alternating liquids and solids during the feeding process will increase if a reduced duration of dysphagia treatments is contingently provided as reinforcement. The independent variable is the use of the dysphagia behavioral modification of alternating liquid and solid boluses during oral intake throughout dysphagia treatments. If criteria is reached, no further practice will be required. If criterion level is not reached, the patient or participant will be instructed in the use of the behavioral modification for 15 additional minutes. The dependent variable is the amount of liquid and solid boluses alternations completed independently without cues per dysphagia treatment. The environment of this study is in the acute care setting. Participants' inclusion criteria are a man or woman between 35 to 85 years old, moderate oropharyngeal dysphagia confirmed during an MBS, confirmed post-swallow pharyngeal residue with an MBS, also the ability to eliminate the pharyngeal residue using the strategy of alternation of liquids and solids, and acute swallowing deficits of 3 to 20 days post-onset. Participants' exclusion criteria includes individuals with history of neurodegenerative conditions, neck and head cancer, TBI, dementia, mental retardation, cognitive deficits, critical illness, drowsiness, inability to maintain an upright body positioning, difficulty following simple commands, inability to self-feed, and previous surgical procedure affecting the feeding process. Results of this study will demonstrate that the participant will meet the criterion each time that is changed. That is what we expect to happen during the process. This figure represents the amount of independent alternations of liquids and solids completed during each experimental condition. As you can see, during baseline, right here, the participant completed 2 to 3 alternations of liquids and solids independently. When treatment phases initiated, the participant was able to reach the criterion during 3 consecutive treatment sessions to provide a baseline for the following phase. Reversal to a former criterion level was provided during sessions 17 to 19. Results showed that the participant met the criterion for all levels. By the final intervention phase, he averaged 100% criterion completion. We conclude that the contingent use of reduced duration of dysphagia treatments can initiate new patterns of responding. Thank you so much for listening. This is all, and I appreciate your time and feedback. Thanks. Bye-bye.